The OPMI Lumera and OPMI Lumera T-ophthalmic surgical microscopes from Carl Zeiss feature revolutionary red reflex technology. With Lumera, you will experience the red reflex in an entirely new way. More contrast, more brilliance, and greater stability than ever before. Welcome to Lumera, the future of red reflex.
Comparing the Lumera to what we've been currently using, which is the Visu 160, it's surprising just how much of a difference this makes. It's really like looking at high-definition TV for the very first time. Things just jump out at you. And so going back to our previous microscope, the view is excellent, but you kind of find it lacking in terms of that high definition, just like going back to a regular television set.
Lumera is equipped with stereo coaxial illumination, or SCI, a revolution in illumination quality. SCI provides unique detail recognition, high contrast brilliance and stability of the red reflex, even with strongly pigmented, decentered, and ametropic eyes. With this technology, you will see the patient's eye in unprecedented detail.
What's really amazing about the view with Lumera is the details of the capsule. We've all been doing capsulorhexis over and over and over again, but when you start seeing the details of the little folds as the capsule is torn, the little perforations, you're seeing it at a different level. And so I think anything where you're looking at the capsule, polishing the posterior capsule, looking at the zonules, making your capsulorhexis, you're going to actually see details that you just didn't see before.
Lumera helps you gain even deeper insights. With the integrated Deep View Depth of Field Management System, you can choose between maximum depth of field and optimum light transmission at the push of a button. The high contrast and excellent detail recognition provided by SCI enables you to reliably and completely remove tissue residue in the capsular bag.
The other area where it makes a difference is actually inside the capsular bag. You can actually see different levels within the bag itself. You can see the undersurface of the anterior capsule better. You can see debris on the posterior capsule as well as in the anterior vitreous space. So it's really quite impressive. Well, in terms of the image that you're seeing on the screen, I think what it does capture is the really enhanced red reflex. And that's because this is the first system where the illumination is actually at a 0-degree coaxial direction with your oculars. So you get a very bright red reflex, and it's almost like, I call it a jack-o'-lantern view, because it's like you put a candle inside the eye and it's just glowing. So I think you can see that very well in the video. Of course, what you don't see on a video is the three-dimensional depth that you get with your stereo surgeon's view, and that's where you can really see just different levels of anatomy inside the capsular bag like I've never seen before.
Combined with the precision optics for which Zeiss is known throughout the world, Lumera's unique illumination and depth of view management system take ophthalmic microscopy to an entirely new level. Lumera is ideal for both anterior and posterior visualization. In cataract surgery, it enables you to recognize anatomical structures in great detail. In retinal surgery, the high optical quality and light intensity allow you to see the retina in full detail. The optional integrated flat screen, MetaLive Trio Eye video camera, the seamless switch from xenon to halogen light spectrum with the new HA-mode filter, Visualux motorized fiber slit illuminator, and highly ergonomic inverter tube provides an unparalleled world-class retina solution.
In terms of where else this would be of clinical rather than purely aesthetic benefit, I think really with a small pupil, this is where the added luminance of the red reflex pays off. Cases like a Flomax patient or just simply a patient that doesn't dilate very well. Of course, the surface area of the pupil is reduced. You don't ordinarily get as good a red reflex, and to be able to now use the Lumera to improve that, I think is going to be a significant advantage. In terms of what the clinical advantages would be, besides just having a nicer, prettier view, I think where it will probably make a difference is when you're looking at a small tear in the anterior capsule or the posterior capsule. You know, times when you're just not sure what's going on. Is it a wrinkle? Is it a tear? And to have that extra 10-20% extra resolution, I think, can make a clinical difference for people.
Other leading surgeons agree. Dr. Thomas Newhand says Lumera provides a unique red reflex that achieves an unparalleled level of contrast and detail recognition. Dr. Warren Hill says, "I've never seen an eye like this. It's simply amazing. The depth of field, the contrast, the red reflex. It is really unique in ophthalmology." The OPMI Lumera and Lumera T are precision engineered to work seamlessly and intuitively in your workflow. Lumera provides the visual detail you need to help you achieve better outcomes with every procedure. Contact your Carl Zeiss Meditech representative today for a demonstration and find out how you too can enter the future of red reflex. The OPMI Lumera and Lumera T, the future of red reflex.